Hello, this is Dr. Yamini Kannappan, Psychiatrist at Kauvery Hospital. In this current era, we are all aware of our public health problems, which are mainly in the form of physical problems. But unfortunately, mental health is still a very neglected area. According to the WHO statistics, if we see mental health disorders like depression and anxiety are much more common than our heart disorders, our strokes, and other major physical illnesses. But the current scenario says that mental health is hugely neglected. One, people are not aware that the mind can have problems of its own, and moreover, public do not want to accept that they have a mental illness, and a mental disorder is something which is so common, which is quite rampant, and nevertheless there is a lot of denial not only among patients but also among family members to accept that something could be mentally wrong with one's own mind. So people just rush in when they have a heart issue or any other physical problem. But when they suffer from common issues which are pertaining to mental health, for example, loss of sleep, loss of concentration, inability to focus on work, memory issues, and pains and aches of unknown origin, they do not want to think that it could possibly be a manifestation of a mental health problem. There are something called common mental disorders. These are two types. One is the depression and the other is anxiety. We all tend to think that why is depression a disorder? After all, everyone undergoes high and low phases of mind. So how can a normal phase of mood be called a disorder? But no, most of the times we are wrong, because the normal moods, when they last for a continuous period of 2 weeks or more, and cause a significant impairment in functioning, then we call a person could be probably suffering from a depressive disorder. For example, a person who has been very interested in normal pleasurable things, such as he would have been pursuing a hobby such as cricket, or he would have been in the habit of watching serials continuously, but this person suddenly becomes withdrawn, and for 2 weeks or more at a stretch, he shows absolutely no interest in what he used to enjoy. And if he is extremely fatigued and he exhibits a loss of energy, and he has crying spells, and he has no sleep, his appetite is very poor, and his thoughts are always racing about probably negative things, this could possibly mean that the person has a depressive disorder. We have to understand that depression or any other mental disorders can be caused by biochemical abnormalities in the brain. We commonly cite certain neurotransmitters such as serotonin or dopamine, the fluctuations of which can cause definitely a fluctuations in mood too. It is extremely important that mental health problems are caught early, because they not only affect the individual but also affect all areas of his life. He might become very poor in his academics, he might suffer in the work area, his family members might suffer. So when all these multiple areas of his functioning are impaired, then it's very important that his mental health needs to be addressed. So it's very important that a huge awareness is spread about mental health, and there should be absolutely no shame or stigma associated with a mental health disorder, because it can absolutely occur to anyone. After all, as we are equating it more to biological terms about a neurochemical deficiency, then it definitely means it can be treated. And there are so many myths about mental illness. One, usually people equate it to a weakness of mind. They say, I'm very weak, or somebody is very weak, and that's why they became depressed or they became anxious. But it's not necessarily so. It does not equate with one's weakness, or it does not mean one is mentally feeble. It just means there could be a biological problem which is happening in his brain that is causing him a temporary low mood or a temporary anxiety problem. So that is one of the myths which need to be addressed. And most of the times people think that going to a psychiatrist, they would be prescribed sleeping medicines, and that's what they do. But actually that's not the fact, because lack of sleep, or even an excessive sleep, is usually a manifestation of a depressive or an anxiety disorder, and that is just one of the symptoms. So probably a small dose of a sleep medicine would be given, but more importantly, we prescribe medicines that are intended to alter the biochemical abnormalities in the brain. So don't get it wrong. All medicines prescribed by a psychiatric are not necessarily sleep medicines, and people do not become zombies or they do not become dullards when on psychiatric medication. And most of the time people think that once prescribed with a psychiatric medication, they have to take it lifelong. Absolutely not. Just like any other disorder, this is also a time bound. So maximum we look about 8 to 9 months of treatment, and after that we taper and stop doses, and the person can be without medicines. So it is again a myth, a wrong perception, that once on a psychiatric medication, the person has to continue it for lifelong. So these are the numerous different misconceptions that people hold, and there is absolutely a lot of stigma associated with meeting a psychiatrist. They feel extremely shy. So what is very important is that when there is so much of suffering, sometimes it's a very subjective one. We do not have any tests or diagnostic markers in the form of lab values to show that a person is suffering from depression or anxiety. But nevertheless, the patient who's suffering from it tells us the intense agony that he goes through, and most of that a thorough clinical examination and a proper history taking would reveal what the patient is suffering from. And this is an absolutely treatable disorder. Depression, anxiety, the most common mental health problems, can be easily treated with very few medicines which have negligible side effects. So what is more important is to throw away the stigma, throw away the shame, because it is not a weakness of your mind. It does not indicate that you're mentally incapable. It just means that your mind is an organ which has its own ups and downs. And just like any other organ which is prone for pathology, the brain or the mind can also undergo certain temporary ups and downs, and which sometimes require treatment. So what is very important is that if you identify that you or your family member have problems that are unexplained by any medical tests, and the person suffers intense personal agony in the form of uncontrollable thoughts, a lot of negative thinking, inability to eat, loss of sleep, and difficulty to concentrate, attention is a problem, not being able to work, not being happy, and losing interest, or palpitations, and intense fear, and a sense of insecurity, it is very vital that this person is seen by a mental health professional, a psychiatrist, who can do a thorough history taking and evaluate and help him quickly out of the problem. So here at Kauvery, we are here to help you not only to take care of your physical needs, but to take care of the most important part of yourself, that is you. So do not hesitate, reach out, help is available. Your mind is what makes you, it defines you. So it is our duty, our responsibility to take care of you. So reach out to us, we are here.